As we age, we may begin to feel less like ourselves, from energy levels dropping to a lack of desire, even feeling like you're losing control over your mood and emotions. Dr. Nina Bajour is here from Oakview Medical Associates to talk about it, to say we don't have to put up with these symptoms, right?
Hi.
Good morning.
Yeah, good morning. How are you?
Good. It's good to see you. Your primary care practice covers so many areas, and that does include services for anti-aging, like bioidentical hormone replacement therapy. How popular is this getting?
Well, it's pretty popular and it's gaining popularity. It's not really very easily talked about, but when we encounter patients, they'll tell us they have fatigue, lack of libido, just feeling foggy-headed, and many times, we do our full workup and find out that it's actually due to a decline in the hormones.
Yeah.
So.
And then you say, just like treating diabetes and high blood pressure, we should be treating against these preventable and reversible aspects of aging, just being proactive.
So hormones actually control all our physiological processes in the body. So just like a low thyroid is called hypothyroidism, low estrogen, progesterone, or testosterone is what we call menopause in women, or andropause, or male menopause in men. And so we have great options now for replacement. And why replace? Because you can get yourself back to an optimal level that keeps you level-headed, keeps your mood good, helps with fatigue, and then it allows you to do other things. Because if you're struggling with hot flashes and night sweats and irritability, you really are in this maze and you just can't get out of it. So I really feel like addressing it, diagnosing it correctly can give you so many options.
It can be life-changing.
Life-changing, yeah.
So talk to us about how bioidentical hormone replacement therapy works at your office.
So bioidentical, as the name suggests, is very identical to your biology, to your physiology. So they're not synthetic. They're plant-based, so they're made out of yams and other components, which are phytoestrogenic, so they have estrogen-like activity. They are much more in line with our physiologic hormones, so they're smoother, and patients, within a few months begin to notice a big improvement in their symptoms. There are different forms. There are creams, there are troches, there are injectables. There's also something called pellets, which are tiny, size of the grain of rice, or even smaller. And those are placed subcutaneously. So there are various forms, and we really want to give you the best information and then customize it for that patient.
Right. And for anybody who's watching this, a consultation is really how you get the whole process started. What do you learn about somebody during the consultation? How do you begin?
So it's very comprehensive. I take a complete inventory of their symptoms, right from their reproductive years, how many children, and where they are now, if it's a female. In men, other things like high cholesterol, whether they've gained weight, increased body mass or fat mass. So we really take into account the whole picture, look at their symptoms, and then we order some blood tests. And those blood tests help us identify, along with their symptoms, what we should replace and how we should optimize it. So it's not a one-size-fits-all. I tell my patients I really need their investment in their time and energy, because then I can find the correct level to get them really optimized and lead a very productive, healthy life. So.
Well, you really work closely with people on that one-to-one basis. You take care of the whole family that way. So talk to us a little bit about your practice and that approach you have to treating your patients.
So my approach has always been very personalized. I look at the person's individual history, looking at their family history. If you have a family history of cancers, for example, I wouldn't use some treatment plan that I would otherwise use. So I have to really tailor it to that individual. As far as our facility goes, Oakview Medical Associates, we really are the primary care home for a patient. So we serve to take care of chronic diseases, but also every time I see a patient, I will, instill in them, okay, you have a little bit of high blood pressure, and explain to them what that means and the things we can do to help control that. And it's amazing. There are medications. Medications are known to help a host of conditions. But at the end of the day, what you do for your health makes such a big difference. It can lower your medications, because medications have side effects. And it can really make you feel like you're in the driver's seat, not that you are a victim of you're having to take medicines and tests after tests. So I really like that approach.
So people can really take control of their health. They can come see you and feel better in a whole bunch of ways. So we appreciate the conversation. Dr. Nina Bajour, you're located at Oakview Medical Associates, 11 Five Forks Plaza Court in Simpsonville. The number 627-0444 is on screen now. Thanks so much for being here, Dr. Nina.
Thank you.